Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, what is the relationship between dental health and overall health? This is a program you're not going to want to miss. And then we have Terry Fitzpatrick from the Energy Association. Catch us up on electric deregulation, and are the rates going to go up or down? All of that following these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, we're going to do some, I don't think we've done this before in whatever it is, 14 years of this program. We're going to talk about the relationship between oral health and general health. Oral health, that means dentistry, dental health. We got a couple of guys coming on here who really know, will give us the right answers. We have Jon Seltenheim. He's the Senior VP with United Concordia Dental. And Dr. James Bramson, he's the Chief Dental Officer with United Concordia Dental. Those were fairly short titles. We can get people on here with titles that go on forever. All right. Doctor, I want to start with you. Oral health. I mean, customarily, we don't even kind of relate that to overall health, do we?
Well, we didn't until we started to collect a fair amount of research over the past dozen years or so, where researchers began to look at oral health, principally periodontal disease, gum disease, because it's a chronic infection.
Right.
And what relationship or links we could find with overall health, systemic health. And the research has shown some pretty strong associations between periodontal disease and diabetes, coronary artery disease. We're also looking at it with respect to rheumatoid arthritis, lupus, low birth weight infants, cerebrovascular disease, and potentially some cancers. Those are kind of down the road a little bit. The biggest association we know now is with diabetes, and that's the one we're focusing on probably the most.
All right. Well, let me ask you this question, John, and as a follow-up. What you're basically telling us is don't skip that dental appointment.
Absolutely.
Twice a year?
For years, yeah.
Twice a year, is that what you...
Absolutely.
Yeah, go ahead. Twice a year.
Absolutely. And it's important that if the dentist finds something, that individuals follow up on it and just not ignore it.
Yeah, well, I mean, I want to get to a couple of other important subjects, particularly the relationship between the Affordable Health Care Act and dental. But I also noticed that when I mean, this is important for our viewers. When I go now, they're checking the glands, they're looking more carefully for early signs of you know, can I use the T word here? Tumor, is that right? Is that what?
Sure. I mean, typically we would recommend that dentists, they all get training in this now, is to do oral cancer screenings regularly when you come in for your overall visit. So what they're going to do is they're going to feel underneath your jaws. They're going to look to see if they can feel for lumps in the salivary glands. They're going to pull your tongue out. They're going to look underneath of it for lesions, early signs of oral cancers. In fact, about 30,000 people every year are diagnosed with oral cancer, and about 8,000 people every year die of oral cancer.
And you would make the point that the early diagnosis is critical, often to survival, right?
Absolutely. Plus, the other thing is, as Jim was pointing out, is that especially if somebody has a chronic disease like diabetes or coronary artery disease, that they go ahead and see the doctor or the dentist for periodontal treatment on a regular basis.
All right, let's go now to the Affordable Health Care Act. We've been talking on this show for several years now about its impact on overall health, but we've not at all focused on dental coverage. How are they related here?
The Affordable Care Act will allow for children to have mandatory coverage. So there are 10 different requirements of what's called the Essential Health Benefit Program. And the last one deals with pediatric coverage for oral and vision services. And as a result, what we will see is children having mandatory coverage as of January 1 of 2014.
Mm-hmm. Now, given that, I think this is the first time I've seen this sort of relationship, again, between a general health care law and specifics that relate to dental care. Do you think this is going to have a huge impact on your profession?
Sure. I mean, we're seeing it all across the profession with the CE that dentists get, the training that they get, the research that's being funded these days to look at connections. In fact, one of the biggest areas of research is salivary diagnostics. They're using salivary fluid to try and look for various kinds of systemic diseases and biomarkers that are in the saliva.
Well, given this fact that we think now, this is going to make additional work, additional requirements for dentists, let me just put it that way, oral surgeons and others. Do you think this is going to lead to a more serious problem for related to the shortage of dentists? You know, we've been talking about shortages for physicians. 50% of the doctors in our state, in Pennsylvania, for example, are eligible to retire. I'm not saying they'll retire, but, you know, conceivably could retire in the next decade. Do you all see a shortage of dentists here? I mean, what is there any correlation between these?
Well, actually, I'm going to defer to Jim. He's the former head of the American Dental Association.
He can help us then.
So he's got the expertise.
Well, there's a lot of manpower models out there, and mostly I think what's thought is that it's probably not a shortage of people in total numbers. It's more of a maldistribution problem. If you go into the larger urban areas, you usually have plenty of providers, and access is pretty easy. In the rural areas, it's pretty tough.
So it's sort of typical of what we see with physicians, where, you know, you've got lack of orthopods and heart specialists, you know, in rural areas. You go to the urban areas. All right, when we come back, we're going to continue. I want to get into this whole business about how children will be affected by the Affordable Health Care Act, and then electric energy. We're going to talk about that with Terry Fitzpatrick as well.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is presented by ReconnectPA.org, supporting a comprehensive transportation funding solution, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program. Well, this is a first for us on Newsmakers. We're talking about the relationship between oral health, dental health, and overall health. This is pretty enlightening to me, and it's we're going to continue on this vein. I want to ask you, Jon, about how the Affordable Health Care Act will affect the coverage of young folks, of kids.
And we're actually waiting for HHS, Health and Human Services, to define what the coverage will be. We hope that we have an answer by the end of this month or early January, and that will be finalized sometime early in the summer, so that we'll know what coverage, because it'll make a big difference from an affordability standpoint. We've had some outside actuaries take a look, and it can be as little as just a pediatrician doing an oral exam, which wouldn't cost anything, to maybe $20 per child per month for some basic coverage, or $50 a month. And so the affordability is going to be a significant issue. So
the numbers that you're quoting here would be for the premiums for the coverage. Do I got that right?
That's correct. And
it would cover this, like you put this guy, you know, working on us. It would cover his services. Is that right?
Correct. Yes.
Is that right?
Yes.
All right.
But
go ahead.
Let me just add one thing.
No, go ahead.
The very positive thing for Pennsylvanians is that upwards of 2 million people will receive coverage through the Affordable Care Act, and probably about 200,000 more children will have coverage than have coverage today.
And would you argue then that by doing this, and I'll ask you, Dr. Bramson, would you argue that by doing this, particularly at an early age, long-term savings will be affected?
Absolutely.
You can finish my thought. Go ahead.
Well, absolutely. I mean, one of the things that we see a lot is what we call early childhood caries. It's cavities. In other words, it's a very advanced and pronounced cavity on smaller children. So the thought is, professionally, to try to get kids in much earlier, establish a dental home. You've heard about medical home, probably. It's the same concept. We want to get kids in before the age of 1, which you might think is really early, but you're trying to intercept disease processes, educate the parents, get in there and start to do some fluoride varnishes so that you can begin to try to keep that decay, which is very small at age 1 or 2, but then turns into some pretty large diseases when they're 4 or 5 or 6, and then the therapy is quite a bit more advanced.
And any other problem that could eventually, that develops early, you can catch.
Sure.
So that you're not looking at something as, some condition that's existed for a time and creating larger healthcare costs, right?
Yes, and we also know that about 80% of all the cavities in America occur in the lower 25% of the socioeconomic groups of America. So, you know, we've got to find programs, and Affordable Care Act might be one of those. It brings those kids into the office that have never been in there before.
Now, one of the other questions, will adults have more or less coverage under the Affordable Health Care Act for dental care, or don't we know that yet either?
Adults are not covered under the Affordable.
You hear this? Adults are not covered under Affordable Health Care. So that means you either got to pay when you show up or have insurance, private insurance. Do I got that right? Or employee, you know, employee or whatever.
Right.
Go ahead.
About 70% of Pennsylvanians have coverage through their employers today.
Yeah.
And about another 20% through Medicaid.
All right, last question before I let you go. Dental trends, where in your field, where is all this going? What trends do you see? More people using dental care, costs going up, any treatments that you see that...
Well, just like any industry, there's a lot of high technology that's being used in dentistry to deliver care, a lot of new materials that are being developed. All of that sort of pushing up against the economy that, you know, is affecting all kinds of folks. You know, I think what we're seeing right now is that dentists, just like everybody else, are, you know, having, you know, tougher years than they used to.
I can understand.
But, you know, as we come out of this, I think everybody believes that we'll be able to offer the same kinds of services.
Well, we've done some national healthcare surveys, and I don't think there's any doubt that people are putting off dental visits, just as some are putting off, you know, seeing a physician because of the recession. And that, in the long term, is probably going to lead, to worse conditions, health conditions for the folks, and more costly at the end of the road. Is that correct?
Exactly.
Absolutely. All right, great update. You'll have to come back when you get these affordable health care, you know, when it all gets plugged in, and we'll see where we go. All right, we're going to talk all things electricity. Switch the light comes on. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Well, it's time to do a little update on energy. Joining me, as often is the case, is Terry Fitzpatrick. He's our energy guru. He's the energy czar. You're not a czar, are you, anymore?
No, you can't use that word.
You can't use
they don't
that
even
word.
use that in Russia.
They don't even use that. He's with the Energy Association of Pennsylvania. He heads it. How about our energy expert? Does that work?
I'll take that,
You'll
Terry.
take that, I know. Hey, look, seriously now, I want to talk a little bit about retail electricity and the competition and what you think folks need to do when to look at whether they want to decide what electric company with the choices that are out there, and whether you think there's enough competition, whether you think there needs to be more promotion of the fact that people can now go out and shop. What's your sense? Former PUC commissioner, by the way.
Thanks, Terry. Well, first of all, if you're thinking about shopping, the PUC has a great website. You can get on there if you just put your zip code in. You can find out how many competitors are offering prices as an alternative to the utility, and you just compare the prices. Right. Also look at the terms, too, to see if the price is guaranteed for 1 year. There have been some customers who took a price, I think assuming it was going to stay in effect, and found out it's a month-to-month price. So you want to look at the terms of that, but the PUC website is great. Yeah. That's a great starting place.
And what's your overall assessment of how the deregulation, you know, the competition is working in our state? As someone who was involved in I mean, are you reasonably happy with the progress that's been made there?
I think this is largely a question, Terry, of whether you look at the glass as being half empty or half full. I think we're doing well overall. I think it's working reasonably well. If you look at the overall shopping numbers across the state, you'll see that over half of the electric load is shopping. Now, most of the great majority of the big customers are shopping, over 85% of that load. With the smaller the customer gets, the less likely the customer is to shop. And with residential customers, we have about a quarter of them, about 25% shopping right now. Yeah. But, you know, it's tougher for the small customers. I think, for one thing, it's tougher to market to them.
Right.
And we also, when these laws were passed, I think this is true of both electricity and natural gas, where you can choose a supplier too. When the government did that, the legislature, it set up a system where if you don't shop, you're still getting a reasonably good competitive price because the utility has to go out and back that up with what we call default service.
And it's regulated.
That service offering is regulated by the PUC. They look over how you purchase and you know, how often the rates are going to change, those details.
Yeah, I mean, I want to move on to something else, but I mean, it's you know, it's fairly complicated. You know, let's just talk for our viewers out there. You know, you got a viewer and they get a couple of things in the mail, and some media outlets have done a good job of, you know, doing some consumer research on it and putting it out to the public. But it's a complicated thing when you get, well, you want to change electric suppliers. What does it mean? Yes. And you get, you know, 3 or 4 pages of you know, of stuff to read, and sometimes. But overall, it's still a consumer choice, right? I mean, it's still, consumers have to look out for their own interests and decide what they want to do, no?
That's absolutely right, and you're right. There have been a lot of efforts to educate customers, and I'll give a plug for Channel 8. Channel 8 has been great, you know, doing research to help people. But yes, it is something that requires some care. In other areas, it's taken a while to get a lot of shopping going. I was involved at the PUC in telephone deregulation when that came about. It took, I think, over a decade for half of the long-distance customers to switch away from the incumbent carrier when choices became available. We're really in the early stages of this.
See, hold on, I'm going to interrupt you here. Sure. That is a great point about the timing, and that's not been, I think, sufficiently addressed. That you can't expect this to be done overnight.
Right. Well, rate caps really just came off in the last couple years for most of the Commonwealth. Not all areas, but most of it. It takes a while for customers to get used to this and to get comfortable with it. So, you know, I think there is an element of patience that's required here as well.
All right, we're going to run to a break. When we come back, I want to ask Terry about the LIHEAP. That's the Utility Assistance Program for the poor, you know, low-income families. Let me put it that way, and where that all stands. It's been in the news recently. And then if we have any time, we'll talk about the infrastructure. We've done that before with Mr. Fitzpatrick. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, welcome back with Terry Fitzpatrick from the Energy Association. All right, one of the situations, boy, is it going to play out very big this year is, you know, can people pay for their gas and electric bills? The Great Recession continues. We have this federal program called the LIHEAP program. We've talked about this over the years. What happens if somebody can't pay their gas and electric bill?
Well, first of all, Terry, the big picture, you're right about the LIHEAP. The funding was cut. It's about half of what it was last year. It's about a little over 160 million available for Pennsylvania this year. That's about half of last year. The recession's also part of the bad news there. The good news with electricity and natural gas is those prices are pretty moderate compared to where they had been at times in the past and compared to gasoline and fuel oil. Right. They're moderate. That's partly because of the recession, partly because of the Marcellus. So that's part of how that helps us. But there are still a lot of customers that have difficulty, and they should be looking to get help and calling their utilities if they're having trouble paying their bills.
Now, I understand that you know, if you miss a month or something, you just can't automatically shut somebody's electricity off. And there's a process that the utilities go through, right?
Yeah, there's a lot of notice that has to be given to the customer. Really, if a customer, you know, the thing I would say to the viewers out there, if you're having difficulty, just don't avoid dealing with the problem. Call your utility, and because they're trained to help you with that. There's various types of assistance. You mentioned LIHEAP. That's one thing you may qualify for, depending on your income level. The utilities also administer their own universal service programs, are called. There's a lot more money actually in the utilities programs that are funded by other ratepayers generally than there is in LIHEAP. But there's really a lot of different types of assistance, but you have to pick up the phone and call your utility to start that process.
All right, so there you hear it. So if you're having trouble paying your bills, don't just run away from it. Call the utility. The PUC doesn't have anything to do with that, does it?
The PUC oversees that. At times the PUC oversees the payment arrangements a utility might give to the customers, and the PUC does a lot of good education about that as well. But telling the customers the same thing I'm saying, call your utility.
All right, there you have it. Call your utility if you get in a problem and work something out. Just don't avoid the problem. Right. It's probably not going to go away. All right, the last thing I want to talk about, you can give us an update on this need to make sure that we have a modern infrastructure to deliver energy to the folks.
Correct.
And where do we stand with the need to improve and upgrade all of the infrastructure?
Well, a lot of the utility infrastructure is aging. We don't have a crisis here with utility infrastructure, but we need to do more to modernize it. The problem is the rate setting process is one where you don't get the money for those investments until you come in for a general rate case, which is a lot of litigation. There's a more efficient process used in a lot of other states and also used in Pennsylvania to recover the cost for water utilities when they replace their pipes. And so we're looking to get those types of tools available. There's legislation that's passed the House by an overwhelming margin. It's in the Senate now, and there's still deliberations on that, and we would hope to get passage of that this session, and we think that'll be good. It'll help to increase those investments, and it will also, as far as how the customer pays, it'll be more of a pay-as-you-go basis. So it's really more gradual recovery of those costs.
Now, one of the things that I've not heard very much about is, number one, was there any money for this utility infrastructure in the stimulus package?
There was some money in there for things like smart grid on the electricity side for some new technologies. We're really talking here more about replacing the real hardcore assets, you know, the poles, the wires, the pipes, those kind of things. That's the type of infrastructure we're talking about.
All right, and then quickly, about 15 seconds, job producing, putting this infrastructure in place creates jobs?
Absolutely. Creates a lot of good family-sustaining jobs, a lot of them union, by the way, as well.
All right, thanks, Terry, for being on the program. We'll see you next week for another edition of Pennsylvania Newsmakers, and as always, you stay well.